I'm Dr. Howard Koh, Assistant Secretary for Health for the U.S. Department of Health and Human Services. And I'm here at the 19th International AIDS Conference, the largest AIDS conference in the world. I'm absolutely delighted to be here with my friend and colleague, Dr. Nils Daulaire, who's Director of the Office of Global Affairs at the Department of Health and Human Services. Nils, welcome.
Thank you so much, Howard.
Nils, you have a very important job at the department and in public health at large. Tell us a little bit more about your role.
Well, the Department of Health and Human Services is really enormously important for global health these days. Between the epidemiology work and disease control work done around the world by the Centers for Disease Control and Prevention, the health research done by the National Institutes of Health, the pharmaceutical control policies run everywhere by the Food and Drug Administration, health services done by the Health Resources and Services Administration, and also the work with injecting drug users and others carried out by the Substance Abuse and Mental Health Services Administration. This is a key department for the global fight against AIDS.
Tell us more about exactly what the department's contributions are for that global response.
Well, this is really the leading scientific and technical department of the United States government when it comes to global health. We work very closely with our colleagues and counterparts at the U.S. Agency for International Development and the State Department. Their roles, respectively, are development and diplomacy. But when you come to the meat of the matter, when you need to figure out the populations at risk, the best interventions, the groundbreaking discoveries that both need to be made and then need to be applied, and also given the enormous depth of experience of HHS's agencies in dealing not only with AIDS but with other issues of health, community health, and services for the American population, we apply those around the world to enormous benefit.
These are fascinating insights from you. So here we are at a historic meeting, and if you had two major takeaway messages from this meeting, AIDS 2012, what would they be?
I think it's become very clear at this meeting that we're no longer talking about just stemming the tide, we're talking about rolling the tide back. With the discoveries that came through NIH on the effect of early treatment, not only on treating those who have AIDS, but also on preventing others from becoming infected, with the research that's going on vaccines, and even the tantalizing prospect that we may be looking towards an era where there may be a cure for AIDS. The research element is vitally important, and with the work of the Food and Drug Administration to certify more than 30 generic drugs that can be applied now, used for AIDS programs around the world, and CDC's work on the ground, along with a host of international counterparts, as well as other parts of the U.S. government, we're really changing the dynamics of the epidemic, and it's very exciting. I've been coming to AIDS meetings for well over a dozen years, and the optimism and the spirit here, I think, is sea change.
That sounds great. So Nils, thanks so much for all you're doing for the department and for global health. And I'm Dr. Howard Koh at the International AIDS Conference in Washington, D.C.